Saturday.
Yes.
So we just do like a postmortem, so to speak, of what happened, medical perspective, and wali kukwenda poa, the weaknesses, like the SWOT analysis, so to speak.
Okay.
So as we build up for the next meeting, at least we have that in mind as we build up for the next.
Okay. So do we give it like a question and answer approach, or maybe I give my perspective of the whole thing? Maybe what our strengths were. Ama, how do you want us to approach it?
Maybe first, if you can give an overview of
Yeah.
what mental health is, because wale wase wa video kidogo hawakushoot sana hapo mali when you're speaking, when I was speaking.
Yeah.
So if you can add some flesh on just what from your professional understanding what the mental health is, and then sasa hapo I can ask one or two questions, and then we can go to the core of the meeting.
Okay. Yeah, just a minute.
You can introduce yourself and say that you are the lead consultant and the professional, the medic professional during our said meeting.
Okay.
And then now you can give your overview of your understanding on what mental health is, because we remember this is the World Mental Health Awareness Month.
Yes.
Yeah, because now that we will be like doing a closure on the month and then way forward here. Ama that one can come in the last. I think that can be the first thing because it
Yeah.
on May 20.
Yes.
May 20. Yeah, you can give an overview of that, and then you give
Okay.
an overview of what you spoke about during the May 8th. Then if there's any question in between, I can shoot in some questions.
Okay. Thank you. So my name is Isaac Babu Kisiangani. I am a doctor with a specialty in psychiatry. So I'm a consultant psychiatry, currently working in Bungoma County Referral Hospital. I was the lead medical person when we had the first meeting at Wendani Community Church, and we talked about a couple of things, and I would like to just give an overview of what mental health is, although it is something that we had already discussed during that period. So mental health refers to a person's emotional, psychological, and social well-being, and it encompasses a range of factors, including how individuals think, feel, and act, and it influences how they handle stress, make choices, and interact with others. Therefore, mental health is important at every stage of life and can impact various aspects of one's life, including relationships, work or school performance, and overall quality of life. It's also important for me to say that maintaining good mental health involves taking care of one's emotional and psychological well-being and seeking support when it is needed. We went ahead to also discuss broadly the various categories of mental health, and we talked about the first category being psychosis. And psychosis, these are not the commonest mental illnesses, but we can generally say 1% of the population usually has psychotic illnesses. An example, and this is the commonest, is what we call schizophrenia. This is the commonest of the psychotic symptoms or psychotic mental illnesses you will ever experience. Basically, in very simple terms, schizophrenia is loss of touch with reality, where someone experiences things that are not existent. You could be hearing voices, you could be hearing people talking to you. Sometimes you could, and those are what we call auditory hallucinations. You could have visual hallucinations where you see things that are not existent. You could be seeing some crazy animals, you could be seeing scary scenes, but actually those things don't exist. It's just because your mind is interpreting an non-existent events. The other broad category of mental illnesses is what we call mood disorders. And mood disorders are actually the commonest of all mental illnesses. The commonest of all the mood disorders is major depression, or let me call it depressive disorder or major depressive disorder. This one is the commonest of all mental illnesses. And I'm saying so because there was a study that was done at Kenyatta National Hospital, another one done at the Moi Teaching and Referral Hospital. And indeed, it confirmed that half of the patients who show up in hospital for any reason will actually meet criteria for depression. So that means half of us, and that was just in a hospital setting. It means even if we did that study outside here, it's possible that the figures might not be as high as the hospital figures, but it's likely to be a very common mental illness. The other one, which we see very commonly, is what we call bipolar mood disorder, which have bipolar 1 and bipolar 2 mood disorders. But bipolar 1 mood disorder is the one that we come across more often. And this one is also characterized by a phase of mania where you become hyper or you become extremely happy and excited. And then there'll also be an episode of depression, or where you become extremely low. So we call it bipolar because you oscillate between the two poles. You get manic and then you get depressed. So those are the ones. Then the other broad category of mental health disorders is what we call addictions. Addictions are also very common, and these ones come in the form of drug addictions. It could be addictions to other things, including social media, that is lately becoming a concern. But more importantly, it's about drug and substance addiction. You could be addicted to alcohol, tobacco, marijuana, cocaine, heroin. Think about any drug that comes to your mind. Then we have another broad category of mental illnesses we call personality disorders. These are some of the most difficult mental disorders to treat because they are shaped by what the person goes through in life, their genetic makeup, the environmental influences, so that eventually how you come up or how your personality develops can actually determine whether it's a good personality or a bad personality. But now in this category, we'll only be discussing the problematic personality disorders. We have examples such as antisocial personality disorder. And these are individuals who harm others and they have no remorse. They do not care about the well-being of other people. They are likely to injure others or engage in activities that will harm others without even worrying or caring about other people. Most of these people with these personality disorders are actually in prison. And if you were to visit a prison, majority of the people are this kind of people with personality disorder that we call antisocial personality disorder. We have many others, including narcissistic personality disorder. We have schizotypal personality disorder, and many others that are beyond the scope of this discussion. So the other mental health disorders that I would also like to mention, including anxiety disorder. It's also a very common problem. We also have other problems such as sexual function disorders that might not be primarily psychiatric problems, but whenever someone has that problem, it's important to assess their psychological well-being. Things like erectile dysfunction, loss of sexual desire among the females and even the males, and such like things. So that is just an overview, and mental health is a very, very broad topic. that we might not be able to exhaust in such a short period of time. So back to you, Isaac. Maybe if there were any questions or maybe any
Thank you,
clarifications.
Doctor. Yeah, I have several questions for you,
Yes.
Doctor. May being the Mental Awareness Month worldwide, what would be your advice to anyone who will be listening to this interview?
Yeah, I would say this being the Mental Health Month, it's a month that we celebrate to just remind us that any one of us can get a mental illness. And it's important that we use this period to even go and get screened for various mental illnesses. Being the Mental Health Month, there are several organizations that are running free drives for screening, whether it's depression, whether it is substance use disorder, including alcohol, whether it is schizophrenia or bipolar mood disorder. And you do not have to just go to people who are running these things for free, but you could actually just show up in hospital and ask to be assessed whether you are okay. Sometimes when you are struggling with a mental illness, you might not be aware that you have a mental illness, and it's people around you who might actually take you to hospital or maybe help you find help. So it is a period that we as healthcare workers would encourage everyone to be screened for mental illnesses. And if you are living close to someone who has or who you suspect has a mental illness, please find time and bring them to hospital so that these people find help. The biggest tragedy is that many people don't even know that mental illnesses are treatable. And that is why, because of stigma, people stay at home with their loved ones until these people do something bad, like dying by suicide. And that is the time when we realize maybe they were not okay. Thank you.
Maybe I've picked a point and maybe I'd want some clarification. You've said dying by suicide, and we are more used to know he committed suicide. So what would be your take on that?
Yeah. This one now brings in the concept of decriminalizing suicide. When we use the word someone committed suicide or the phrase someone committed suicide, it looks like we're blaming the person who died through that action. But many times people who die by suicide don't just do it from nowhere. Majority of these people usually have some underlying psychiatric problem or some underlying medical condition or some underlying mental health issue. They could be having issues such as depression, and this is one of the commonest causes of death by suicide in people with mental illnesses. So when we say commit suicide, it's like we are saying the blame lies on the person who has died by suicide. But when we say someone died by suicide, we're looking at suicide as any other cause of death, as malaria, as typhoid, as a road traffic accident, so that this death, we don't judge these people even in death, because those ones who are alive and are thinking about suicide might even be stigmatized in terms of being unable to access help or healthcare services. That's why I used the word die by suicide rather than commit suicide.
Yeah, I think that's something that we should really understand and get to know. And as psychiatrists, are you pushing any bill in parliament to make sure it happens? Because I know of now, if anybody dies by suicide, I have to start learning using that. They are jailed, they are taken to prison. So now that from this understanding, is there anything that can be done to decriminalize suicide?
Actually, you are absolutely correct. There are so many steps that are being taken to decriminalize suicide, and it's important for us to note that decriminalizing suicide does not mean legalizing suicide. It means just making sure that people who attempt suicide end up in hospital rather than in a courtroom. But our justice system has been very fair, to say the least, because majority of people who have found themselves in court for attempting suicide are usually sent to hospital rather than to jail. Although in the Kenyan Penal Code, it is actually criminal. It's a criminal offense to attempt suicide. And this one has been counterproductive because the people who attempt suicide, because of these legal obstacles, might not seek help because they feel like maybe they'll be arrested, they'll be taken to court. But the former senator, her name is Sylvia Kasanga, brought a bill to the last parliament, and that bill actually contains some information about decriminalizing suicide. Although those are issues that are still being discussed, but I would like to applaud a country like Ghana. Ghana was one of the first African countries to decriminalize suicide, and the Ghanaian parliament voted unanimously to decriminalize suicide. And this was just about a month ago. So Ghana has taken a bold step, and I'm looking forward to Kenya as a country through our legislature to correct some of these messes that came about because of the very old beliefs and the very old legal structures that are no longer useful to human health today. Thank you.
Yeah, well, I think that's information that during this month should have been brought out there for every Kenyan to understand. I think we missed a big part of sensitizing the public about this.
Yeah.
Thank you for what you guys are doing. And back now to the meeting we had at Kahawa Wendani when we were doing the World Mental the Women's Day. We did the women's and mental health, and you are the lead professional on that. What is your take? And by the way, as we were doing the meeting, somebody died by suicide. If you remember, a message came in just when we were finishing the meeting. Some young guy had thrown himself from a balcony and he died on the spot. So what do you think, what would be your take on that day especially? And the questions that came up, I think you handled most of the questions. So what would be your perspective on that day?
Thank you, Isaac. I think it was a very good step. It was a very bold step by the Wendani Community Church to organize such a thing. And it really means that people are beginning to have this discussion about mental health. Many times and many years back, people used to be scared of talking about mental health issues. People used to stigmatize people with mental illnesses. But if we can bring this conversation to church, that means we are likely to reach more people. And just from the questions that were being asked that day, you could tell that people are so interested in these things, but majority of the people don't know who to ask these questions because there's no one to talk to. But if the church, which is very close to people, and through church leaders, we can actually come up with a conversation about mental health, we are likely to reach more people, because many people will actually only reach hospital when they are mentally ill, or when people around them discover that they are doing a few things that are not okay. But I think it was a very, very good initiative by the church and by the team that organized it. And I'm looking forward to engaging the community in many of these things in the future, so that we destigmatize mental illnesses. We let people know that just like any other body organ, the kidney, the lung, the eye, the brain can also fall sick. The mind can also fall sick, and it can be treated. Thank you.
Oh, that's good. So you think we should organize more of such forums?
Yes, I think it would be absolutely useful. One of the few challenges we had last time is that this forum ran late in the afternoon, and therefore a good number of church members had already left. So we didn't have the largest numbers that we would have expected, but I'm sure these are things we had discussed before. Would say we will plan better next time so that this session maybe begins a bit early before just after the service so that we can reach as many people as possible. But it was such a well organized event.
Yeah, I think we noted that, and that's something as we plan for the next meeting, that's something we will factor in. I think that's good. And that's that's the only weakness you notice. If there's any weakness, and then you do the strengths.
Yeah, there were more of strength because just coming up with that initiative was a good enough strength. The weaknesses, I would say it was just about the numbers, and this one could have come up purely because of the timing. We know it was a Women's Day, and many mothers who were in that church maybe had to go home and attend to their children because the sessions began late in the afternoon. But in the future, we will think about having these sessions earlier in the day, or maybe just shortly after the service so that we reach as many people as possible.
That's something noted, and as we are planning for the next meeting, we are working on that. And then what would be, as we finish, what would be your parting shot?
Didn't hear you well.
What would be your parting shot?
Oh, I would
as we
say,
finish?
well, thank you, Isaac. I would say, let's continue the conversation about mental health. Uh, I would use an example of illnesses such as HIV/AIDS earlier in the 90s. There was so much stigma that surrounded these illnesses. But some of these illnesses, for example, HIV, is something that people have studied so much research has been done about it, to the extent that even a patient we can predict how a person with such an illness is going to live and how his quality of life is going to be, because so much research and understanding has come up about this illness. But the case is not the same for mental illnesses, because there are still so many gray areas in the field of mental health, and the stigma that we have right now about matters mental health is even worse than the stigma we have about HIV, because people have come to understand that with ARVs and regular follow-up in hospital, HIV is no longer killing people. But stigma that accompanies mental illnesses is so bad to the extent that there are even families that hide their loved ones from people, especially when they have guests at home, so that even guests don't have to notice that this family has a person with a mental illness. And stigma delays care to the extent that by the time these people show up in hospital, a lot of time has been lost, and a lot of the period that we would have used to treat them would have actually also lapsed. So I would say that let's be ambassadors of mental health. Let's keep the conversation talking. Let's talk about these problems. Let those people who have mental illnesses be informed that it's not the end of life, and most of these mental illnesses are very treatable because a lot of research work has been done on them. I would also like to conclude by saying that let's be our brothers' keepers, let's be our sisters' keepers. Many of these mental illnesses just come because people are not talking. If we create a platform where we are talking to each other, we are offering a crying shoulder to our friends who are in trouble, we are sharing our problems, we are likely to be better people, and we are likely not to end up in hospital to seek mental health services just by talking to someone about our problems. Thank you, Isaac.
Thank you. I've just remembered something, maybe that will be what will conclude. I've personally been to several mental health facilities in the country, and I can confidently say that they're in a very pathetic state. As a professional there, what would you wish to be done? That is not being done at the
Okay. most of our mental health institutions look the way they look because very little investment goes to mental health. Even if you look at our national budget, very little is allocated to mental health. Much as about 15% of our national budget is supposed to go to healthcare, it is sad to say that of that 15%, less than 1% goes to mental health services. And that is so wanting and disturbing. That is why most of our mental health institutions look the way they look. They look like some small prisons, poorly maintained prisons. However, I would also like to say that things are not as bad today as they were 10 years ago. The previous administration tried to focus so much on mental health services, and we are moving in the right direction, but we are not yet where we are supposed to be. So what I can say is that we need to invest more in mental health services. We need to invest more in the facilities. We need to invest more in education. That means training more mental health providers, because Kenya today has a total of just about 100 practicing psychiatrists, and more than half of those are within Nairobi and Eldoret. So you can imagine the rest of Kenya is sharing just about 40 psychiatrists, and that's a big problem. If we invest more in training and the infrastructure, we are likely to be better. But I would say we are taking the right direction.
Thank you, Daktari. That has been Dr. Isaac Kisiangani. He's a consultant psychiatrist and is the lead psychiatrist in Mental Health Convo 254. I hope you had a wonderful time. Thank you.
Thank you so much, Isaac.